what is dry needling? Dry needling is one of our favorite therapies to use in the office. We think it's a great tool to use with adjusting and rehab exercises. And there are several questions that people ask quite frequently about it. The top question is, what is it? So when we do dry needling with a patient, we're putting a needle into a knot or trigger point into the muscle. Another question that we get often is, why is it called dry needling in the first place? So dry needling is compared to trigger point injections. In these injections, same thing, a needle's going into a trigger point, but with the injection, just like it sounds, usually a steroid or other medication is injected into the trigger point. So with dry needling, nothing is put in, nothing's taken out, it's just the needle into that trigger point. Another question we get frequently is, what does trigger point needling feel like? Everyone has a different experience of discomfort, but most people wouldn't classify it as painful. Typically, people will feel either nothing at all or a slight pinch when the needle first goes into the skin, and then usually they'll feel some kind of weird, deeper pressure into the muscle when we get into the trigger point or knot that's contributing to their symptoms more. This is often accompanied by a muscle jump or twitch response, which is completely normal, and it can be a little bit uncomfortable, but most people, again, would not describe it as painful. When we use dry needling in our office, it's usually for one of three main reasons. The first is for acute injuries. So let's say we've got an athlete in, they just sprained their ankle. We can use dry needling to promote more inflammation in that injured area to help speed up healing. So whenever we have this acute injury, the more we can bring blood flow to that area, the more healing components we can get right in that site that needs a little bit of extra help. Another reason we'll use dry needling is to help relax tight muscles and to help relieve pain. When we put needles into those trigger points, it's almost like they're a small cramp that our body can't get rid of without help. So when we put the needle into that small cramping area, it can help the muscle release a little bit, which can provide a lot of pain relief. The last main reason we'll use dry needling in our office is to help improve sensory awareness of an area that our brain has a harder time connecting to. So a lot of people, not that muscles fall asleep or wake up, but they can have a harder time activating the right muscles at the right time. This is where dry needling can be an excellent tool. Let's say a patient has a harder time connecting to their glutes or feeling their glutes active during a lunge or a squat. If we put a needle right into that area that we have more difficulty feeling, it can make it easier for us to find that muscle. We'll often joke with patients that there's no better way for you to identify where a muscle lives than by putting a needle right in the middle of it. So dry needling can be effective for many things, but we especially use it for treating acute injuries and increasing inflammation, getting muscles to relax and for pain relief, and for getting muscles to wake up a little bit more.